All right. Assalamu alaikum everyone. I welcome you all to today's webinar. We are from Department of Public Health. The topic of today's webinar is the national surveys and their implication to national maternal and child health policy. With me, I am to introduce myself, I am Dr. Sameera Ali Rizvi, Assistant Professor, Department of Public Health, Faculty of Life Sciences. With me is Dr. Bilal Siddiqui. He is the Program Manager in the Department of Public Health, Faculty of Life Sciences. Today's guest is Dr. Imran Khan. Dr. Imran Khan is the Executive Director at Precision Health Consultants Global, a private public organization in Pakistan. Dr. Khan is a public health practitioner with a PhD in international health from Johns Hopkins University. He has more than 18 years of experience in design, development, implementation, and evaluation of health systems delivery programs in Pakistan and globally. He has led several initiatives for the preparation of burden of disease studies for national, regional, and global estimates, working with academia, research institutes, and funding agencies. In the past 5 years, his work has focused on addressing delivery challenges, taking into account the triple burden of disease in Pakistan, where MCH indicators have not yet improved. Dr. Khan's work is published in the form of 35 scientific publications, which are peer-reviewed journals. So, the webinar's main major topic is about the importance of national health surveys and their application to national maternal and child health policy. With this, I would like to welcome Dr. Imran Khan. How are you, sir?
Assalamu alaikum. I'm all right.
Salam.
Good. Very good.
Good to see you. Good to see you today. I hope you are well, coping up with the COVID days and times. We are so glad to have you on board, and we would like to have your insights about the national surveys that are being conducted in Pakistan recently and in the past few years, and what are their implications on our health policy, especially with a focus on maternal and child health. Over to you.
Thank you, Dr. Sameera, and thank you, Dr. Bilal, for providing this opportunity. I think this is really great that although you mentioned about COVID, yes, COVID has affected us in both positive and negative. I think the positive thing is that while we are in different locations, we can still connect through these webinars. And the topic that you have selected and provided me the opportunity to talk about is very relevant when it comes to designing or scaling up maternal, newborn, and reproductive health interventions. This is also very timely because I am currently engaged with the Department of Health in Balochistan, where we are discussing, and we all know that after devolution, the provincial departments of health are looking at their own health policies, health strategies, and an implementation plan. And the use of evidence in this particular situation becomes really important. I understand that a lot of our audience today are students and public health practitioners. I acknowledge and congratulate you and your team for selecting a topic that is cross-cutting. It starts with conducting surveys, using the information from surveys for advocacy, and not only that, but then using all the estimates from different sources to design policy, and at the same time to evaluate what has been done in the past. And I think the first important question one may ask is that why do we need surveys? Information about health programs are critical. And as we all know, that this is one of the key factor in the WHO framework of health system building blocks. Information could come through routine, or information could come through surveys that are conducted. Unfortunately, although there has been a lot of work in the past for strengthening the flow of information system within the health system, but I don't think we are at a stage where we could regularly look at the information and data that are coming through our health management information system, or district DHI, which is District Health Information System. So what is the alternative then? The alternative is that the government, with the support of different partners, then conducts surveys. While these surveys are useful, valuable, there are certain caveats attached to this method. We all have been trained in different time points at Al Khan University, and when I was being trained in my master's course, we always aimed for the standard study design, which is like a double-blind placebo-controlled trials. But over the years, what I have learned, and I have noticed, and I have appreciated, that while we think surveys are very easy, they are the most difficult, challenging study designs. I'm saying this because at each level, how to design a survey, how to implement a survey, how to analyze the survey, and then how to use the information generated through these surveys. But I don't think that is the topic of the discussion today. So what we can see is that there are multiple surveys that are being conducted. Mostly these surveys are supported by development partners in Pakistan. One survey that we all know is the Pakistan Demographic and Health Survey. This is conducted, it's not very regular, like it's not every 3 years, 4 years. The first one, I think, was conducted in 1990. The next one was in 2006, then 2012-13, then 17-18. So these are at different time points, these surveys were conducted. When we talk about any survey, we have to understand what are the objectives. As the name suggests, this survey is usually more focused on the demographics and health indicators, but at the national level, and also is powered at the provincial level. And I'm going to then later talk about that, what are the challenges. दोबारा फोन करेगा यार, डिस्कनेक्ट करो उसको. I am sorry. Can you hear me now?
Yes, you are.
Well, since I'm using my hotspot, so my apologies. There will be phone calls, so there may be some interruption. So I was talking about that I will refer later.
I think Dr. Imran's connection is a little bit tricky right now. Dr. Imran, we will want to hear your communication. So please try as yourself. Otherwise, let me intervene that today the main objective of today's webinar is to discuss the health policy and the role of surveys in health policy as well. In terms of health implementation, how would we, these surveys and the data obtained from these surveys would be helpful in order to assist in health policy, and what would be the potential barriers and what are the actual potential barriers in terms of implementation and devising the surveys in order to implement and deliver a proper, timely and quality health services to the health community. So that is one of the major challenges what people are facing, the whole population of Pakistan and in developing countries, other developing countries as well. So currently we have so many issues in terms of health services and delivery of health services in terms of maternal, reproductive and child health policy and their implementations. So that is the main reason we planned this webinar to conduct, and we have got Dr. Imran Khan, who is a well-known researcher, health policy analyst and implementation specialist who have an experience of more than 18 years in terms of designing the health surveys, and he has got affiliations with different public health institutions locally as well as globally as well. So that is the main reason we are here. Dr. Imran, can you hear the communication, or all right, we are still facing some issues from your end, sir. Let him come. Let
Yes.
Dr. Imran come back, and then we
So
will see.
till the time he's coming back, we have seen in recent years that maternal mortality rate for Pakistan, if I talk, it's roughly around 186 per 100,000 live births. And if we also look at the under 5 mortality, it has come down from 72 per 100 live births to around 67.2 per 100 live births. So, Dr. Bilal, as an expert, what do you think? What can be the major reasons? Where have we improved if we talk about under 5 mortality in Pakistan, particularly?
Thank you, Dr. Sameera. Thank you very much for that. A projection of the current status of child and maternal health in terms of the major indicators. Well, one of the major issue currently we have is the lack of data. Number one, having a lack of data. What do we mean by that? Since we have, you can see on the screen that we have got different sort of national as well as different public different domains of institutional based surveys as well. Let me tell you that nationally we have got a list of different types of surveys, which include the major one, Pakistan Demographic Health Survey, which we call PDHS. It started from 1971, and currently we have like sixth or seventh version of the PDHS, which occurs every 10 year almost, plus minus 4 5 years. So every year we have got such this Pakistan Demographic Health Survey, and this Demographic Health Survey works on a sample data. Like, it doesn't work on the whole population itself, but it takes a sample, and then from that sample they collect different demographic, different health, different determinants and different indicators based on which are relevant to the health. which include fertility, child health, child mortality, child immunization, and things like that. So since it works on a sample data, we don't have the exact information outside the sample data. Obviously, the sample is usually collected in such parameters that it reflects and shows the generalizability of the Pakistani population. However, there is obviously a chance that it may not reflect the overall, trends and situation in the whole population of Pakistan. So there is one of the limitation. One more thing, that child birth registration, child mortality registration, we don't know. We don't have any idea about how many children are registered under 5, and how many under 5 children are registered with their mortalities, how many children died. So how, based on such limited amount of data, only, let's suppose in Pakistan currently we have got 34% birth registration. So it means government of Pakistan only knows about 34% of the population which is registered. Based on that, we collect the data. Rest of other population who are not registered with Government of Health and the Government of Health Management Information System. It is a system in which all the data and the IDs of the registered children are located in the Health Management Information System of Pakistan. So these, since we have got a lack of data in terms of child birth registration and child mortality registration, we don't know the major causes of mortalities and morbidities. So based on that, how we can say that large number of children are dying because of diarrhea? If we have a knowledge and numbers of children who died from whole population, if you see, lots of children are dying in each and every gully and mohalla, and they are not registered and government doesn't know. Lots of stillbirth are going on in Pakistan, just like in the other developing countries. So they are missing. Government of Pakistan is missing such data to be incorporated in its own HMIS. So that is one of the major issues that government of Pakistan, Pakistan's HMIS, Health Management Information System, is lacking the details of each and every birth and death. Based on that, we cannot say that we have got information on each and every child who is registered as a birth or other mortality cases. So based on that, we don't have any data, and once we don't have any data, we cannot take proper plans and implementations to prevent the child mortality and maternal mortality cases. So the main option and the main direction should be to minimize or to improve the estimates and records of registration of children and mortality cases of mothers. So that is one major issue which need to be sorted out at a first instance. Yes, Dr. Sameera.
Thank you so much, Dr. Bilal. So what we understand from your talk is that we do not have conclusive figures coming out from the survey. So what does that mean? Since our students are also listening to this talk, so for their information, I would like to hear from you till the time Dr. Imran is joining us, that we are saying, on one hand, we are saying that these surveys are not coming up with conclusive information. So what are the options? From where should our students get the correct figures? Should they rely on the project-based surveys, or should they keep on relying on these figures? So what should be the way forward then for them?
Very good question, Dr. Sameera. These surveys stand out. Currently, we have a problem in terms of COVID situation, in which the students and the public health students cannot go in the fields to collect the data, and have security reasons as well in terms of health. So we suggest that we have got plenty of institutes who are working under the domain of public health departments, like Government of Pakistan, like private institutions, academias as well, who have got their own study sites as well. So the students can utilize and have a better option to use that data which can be easily obtained from these institutes and platforms. And based on that, they should, work on very unique and novel concept ideas in which will be helpful and which would be, much best at its implementation, that they can utilize that data uh, for implementation and for developing certain recommendations that will be helpful for the MCH policy and implementation plans. So they can use the secondary data which is available, and obviously secondary data has got its own limitations, and we know all of such limitations in data collection and data assimilation. So based on that, however, if they have a better guidance and better supervisors and best trainings they will get, obviously they will be better in a better position to utilize that secondary data for implementation of the such surveys. Yes.
Right. Thank you, Dr. Bilal. So with this, I have another question in my mind. And I think this question would be very pertinent to our for the sake of our students. We have, since we are talking about secondary data analysis now, so we have PDHS in our hands. We also have National Health Survey. So now a question that is coming to my head is that whether this data comes first to a student, or should the research question should come to his mind. So Dr. Bilal, my question is, I hope you understand that taking it in a simpler way, my question is, for a student, should data come first, or should a research question should come to his head first? Yes, please.
Very valid point, Dr. Sameera. Thank you very much. We have got Dr. Imran Khan online. If we will be able to see that we can use his conversation. Dr. Imran, Assalamu alaikum. Yes. Dr. Imran is still, I think, struggling to connect with us. He is already connected, however his voice is a little bit distorted, so probably because of the internet connectivity. I would like this question to be answered by Dr. Imran Khan, because he is our guest speaker, and if he is available.
Currently, he's sitting in Balochistan, maybe because of weather, or maybe he's in some far-flung area. That's why he's facing some network issues. So I hope he gets connected.
Can you hear me now?
Yes, we can.
I'm very sorry, and my apologies. I don't know. This has not happened before. Otherwise, I could have made alternative arrangements. Dr. Sameera, if you can hear me, what is your question? Can you please repeat? Because I was struggling.
Yes. Dr. Imran, my question was that when you were away for some time, then Dr. Bilal was explaining about the uses of secondary data for our thesis students, basically for our master students who are enrolled in our programs. So my question was that since the students have reached to secondary data, they have PDHS, they have national health surveys, economic surveys also there. So my question was whether a survey should come to a student's hand first, or should the research question should be leading his way. I mean, a question should tell him what should be his way forward. With question, I mean research question. So how would you guide our students in this domain? Yes, Dr. Imran.
Can you hear me?
Yes, I can.
Can see.
Yes, sir. Yeah, Dr. Imran, we can hear you.
यार क्या हो गया है? तुम अपना दो यार.
All right, Assalamu alaikum. Let me take that question. In the meantime, Dr. Imran will try his best to come back and join us. Your question was, Dr. Sameera, that would the research question should come first, or the data should come first? Well, basically, data is already there in in our different platforms and different institutes and different areas where people are working and they are gathering data. So we have got plenty and plenty of data available in different domains wherever the human is working, and wherever the public health practice is going on. So we have already data. So data comes first. However, based on our requirements and based on our preferences, we assimilate, and based on we know that already the data is available in that domain. And if our area of interest is, let's suppose, fertilization or reproductive health or family planning, let's take family planning. So we can utilize that particular data which is available in the different platforms, and then based on that we develop our questions based in the light of our availability. That such day we need to work on the availability of family planning in what are different areas which need to be catered, what is the need of the society, and what areas should be work upon. So based on our requirements, we develop our questions and we develop our what we say requirements, and based on that we collect the data which is already there in the field. अस्सलाम वालेकुम डॉक्टर इरफान.
अब आ रही है आवाज?
जी बिल्कुल आ रही है.
I'm very sorry.
It's all right,
This is the
Dr. Imran,
third
no
network
worries.
that I'm trying. Or something has happened today. कुछ हो गया. I don't know what has happened.
Okay.
So, Dr. Sameera, to your question quickly, I think as students, my advice.
And Dr. Imran, again the voice is distorting.
Dr. Bilal, can we take him on the phone and he can come on the speaker? Will that
I
work?
think that would be much better.
So let's try that. We can take him and he can open up his speaker, and we can take him online. So I hope the students that are listening to us, they would have listened to this conversation, and I think we have had we have given quite a good emphasis on the importance of secondary data analysis, how they can make use of such data sets for their research and thesis purposes. So, and especially if we take into account the COVID days, we all know the situation that is around COVID. Waves are coming back again and again. We are into the fourth wave since this July. Still, I would feel that we have stressed quite a lot that research should not stop. We should not stop working. We can make use of the available data sets that are there, though they have some barriers, they have some limitations, but students can make use of those data sets. Just a second, please. Yes. data analysis in front, when they have secondary data in front of them, what should be the way forward for them? What would be your guidance?
Well, I think
I can hear you.
okay. So the question is that once you decide on your research question, I think this should be the first step for us. We need to have a research question first, and then once we have the research question, then we try to look at what are the sources of information that we can use to address that question.
Sure. So Dr. Imran has, I hope you all can hear him. His point is that the research question should come to your mind first, and then you can come up with several ideas. You can make use of different secondary data sets that are available. But as a student, thinking about a research question is utmost important. Thank you, Dr. Imran. So over to you, Dr. Bilal, with your questions.
Acha ji. Assalamu alaikum. My query is, since we have Dr. Imran online, let me take the opportunity to discuss the issues of current implementation in terms of lack of availability of data and lack of records and weakness in the HMIS and civil registration vital statistics. Let me take you in a picture that to work and to develop interventions, we need data, and we need to know how many people are registered with the current health system and how many people are currently registered, because the population dynamics need a strong number of collected data. So based on that, we need a huge number and maximum registration of the children and the maternal cases as well. How many children are currently registered with with the civil registration vital statistics, which we have called NADRA here. So based on that, we need data, and that since we don't have huge amount of data available which can be helpful to assimilate. So my question with Dr. Imran, what is the possibility that how we can improve our civil registration and vital statistics and its connection with with the health system.
Can you repeat the question? I missed the question.
All right.
Dr.
Imran, can you hear me?
If you can speak the question in the mic, because I think the distance was more between you and the mic. I could not hear the question.
Dr. Imran? Assalamu alaikum. Dr. Imran, can you hear me?
Yeah, I can hear you now.
Okay. My query is that since we have, the thing is that there is a lack of data in terms of child health and maternal health. So the government of Pakistan does not know the actual number of registered children, registered cases of mortalities, and registered cases of morbidities in terms of maternal health. So since we have limited data available, how can we improve the data so that we get a maximum number of available databases which can be helpful to develop interventions and further improving our health policy in terms of MCH?
I think there are two parts of this question. One is how do we know the basic indicators? Like, of course, we always start from mortality and births. The existing registration systems need to be improved. The major challenge in improving that system has been access in the rural areas. I definitely would recommend for our young that they should focus more on how do we improve quality of data in areas which are uncovered. For example, we have lady health workers. They have a system of registration, but we don't have lady health workers everywhere in Pakistan. Second is we don't, the data that is collected by the lady health workers are not, the quality is questionable or it is compromised, I must say. The third one is that there is a disconnect because birth is a Department of Population issue, birth registration, and then infant death or infant morbidity or child morbidity and mortality are the subject of Department of Health. These two need to connect. I think one good thing that has happened in this instance is that now we have a minister. She is leading both departments. I think this integration needs to go to the lowest level. We have these, I'm forgetting the title of these women who are working for population department. So wherever there are no lady health workers, these people can be utilized to collect that information. Right now, the major challenge is that we are not collecting this information. Even in areas where we are collecting the information, the quality is not of expected level. So the two areas that we need to work on is that we should focus more on increasing the coverage for this information collection. And the second level is that once this information becomes available, we should start looking at these numbers so that we understand we know we can improve the quality. So at least these two measures, and there is a lot of interest at government level. The departments of health, all the provinces, especially in are very interested in doing this. I think this group of our students should pick up that as a subject of their thesis. When we talk about information, what are the information collection challenges, and what are the challenges in terms of, or how can we improve the quality of the information that is being collected? So then this will definitely help in having the numbers, and once we have the numbers, these need to be discussed. The one challenge that has been that once we do these surveys, all the information previously used to stay at Islamabad level, and now it is only being referred either in research papers or people only look at this in Karachi or maximum Hyderabad in the city office. The use of this information should go down to the lower level. The districts should discuss that, okay, for example, we have one survey which is mixed, which is powered and division, and I look at the district level for morbidity and needs. So the departments need to own these data. Yes, the generalizability may be questionable, the quality may be questionable, but unless we start looking at these numbers, the quality is never going to improve. I think the mixed survey was released, the report was released yesterday in Karachi, and I want to highly encourage all the students to look at the report, try to identify areas where they can contribute to either improve the quality of the data or address implementation challenges.
Very well described, Dr. Imran. Thank you very much. And a lot of people who are listening to us had a clear understanding now that what is the current situation. And obviously, Dr. Imran, what do you think that since let's talk about child mortality and child morbidity. Since we don't know the number of mortality cases in Pakistan, lots of children are dying in each and every gully mohalla, and lots of stillbirth are going without notification to the government. So as we know that the major cause of child mortality, we say in the literature that in developing countries we have diarrhea and pneumonia and birth asphyxia. These are the major causes of child mortality. But until this is based on only 5 or 7 or 10% data available, which are registered mortality cases. If we know all the mortality cases and we do know the causes and verbal autopsies and things like that, we implement them, and then we will be able to have a clear understanding that what were the causes of mortalities in that missed mortalities. What do you feel about that?
We used to say, you remember when we were working together, Leon 𝗪𝗏𝗧𝗏,
Yes.
used to say something all the time, that don't let the best enemy of good or better. While we can aim for the best information, yes, we should always do that. I think we should start making use of the existing information. If, for example, if the under 5 mortality incidence is, let's say, 90, let's take that as a baseline. I mean, yes, there will be a lot of challenges, but the point is that is 90 acceptable? Is okay? And then what we are referring or interpreting point estimate in a survey, we need to look at the uncertainty, like the 95% confidence interval. That is a critical thing that we as public health researchers should always take into account. Unfortunately, in these reports, these are not mentioned. I think recently they have started, but I think I would highly encourage our students to look at the confidence interval. For example, if the point estimate for child mortality is 90 per 1,000 live births, and the lower limit is 40, and the upper limit is 200, this is not a good estimate. But if the point estimate is 90, and the lower confidence limit is 85, and the upper confidence limit is 92, so now I know that the child mortality for SZABIST or for any other province lies somewhere between 85 and 90. So, as students, I would highly encourage us to start thinking about, to understand the design and then the application or implication of these design challenges in surveys. So, yes, we have improved our quality of data collection in the past 20 years, but I don't think we are there where we can say that, okay, this estimate or at least this number is still X number of children are dying every year, and that we are definite about it. It is going to take some time. So until we reach there, we should aim for it. Until we reach there, we should make use of whatever information is available. Doesn't matter if it is coming from maybe, doesn't matter if it is coming from MCH, doesn't matter if it's coming from a survey that MCH has done, let's say, 𝗪𝗏𝗏𝗏 has done, or Indus has done, or any other organization, SZABIST has done. So that's fine. We need to make use of the information, and we all know that evidence-based decision making is a big topic in public health and development sector today. But my request to our new young generation of researchers will be to make use of whatever information is available. If we are not using any information, collection of that information is a crime.
Right. Very well said. Right. Thank you. And do you feel that are there any challenges, in implementing the existing health policies so that a proper delivery of healthcare services in government as well as private, healthcare delivery platforms should be improved, can be improved? Are there any barriers or limitations or challenges?
I think this is a great question. For example, if I were to give the question that you have just asked, I would give it as a capstone or a research topic to my students. Okay, what do these surveys tell us about the challenge? And if I look at the surveys, and to because I am on this assignment with the Department of Health in Pakistan, we are actually looking at it. And if you look at, again, we need to refer to the health system building blocks, the framework that the World Health Organization has done. I have a lot of disagreements with the way World Health Organization works, but I have a lot of respect for the documents that they develop. They are really well written. They do highlight the issues. They give us guidance, so we need to refer to those documents. Challenges are definitely, it starts from the governance, then it is the human resource, and then is our information system. So these are the three major areas that need to be improved. And they will be improved once we start looking at the numbers that are coming from different areas. One other area that I would also recommend for our students to think about is that these 89 deaths per thousand, it is not a number. These are 89 families. Out of 1,000 births, 89 families lose their children. So bringing these numbers down to the different strata is critical. For example, when we are looking at these estimates, and if you look at SZABIST, which is released yesterday, if my information is correct, then you need to look at that how does this estimate range by urban rural, by division, by income quintile. And I did this in 2016. I did not do an analysis. It's just a descriptive statistic, and you need to look at the numbers for let's say, infant mortality. If you look at infant mortality for the richest versus the poorest, ignore the middle quintile. Just look at the richest and then look at the poorest. There is a significant difference. The richest, I cannot remember the numbers, but if you look at the infant mortality for the richest, they are close to a developed country. And for the poorest, they are close to the worst situation for mothers and children in any, and usually referred to Africa, but unfortunately there are places in Pakistan where the mortality is very high. So how does this information guide our policy? We have talked a lot about there is the social protection program, the accelerator action plan. I'm sure there are people who are working from your student cohort in that project. So why was it designed that way? Why was it designed the way it is? Because we looked at those numbers. We looked at the results of the surveys. And the surveys guided us that, okay, these are the poorest women who are dying. They are the children, the poorest households where the children are dying. That's why the social protection mechanism or the insurance mechanism were designed and implemented. So it's not that we have not made use of all the information, but the major challenge has been that the discussion has to trickle down to the lowest level of health system. These discussions for why our children die, where our children die, this discussion needs to happen at the district level and maybe at the facility level. Another source of information that is used is death audits, and we are thinking about. There are different projects that are going on auditing the deaths. It could be one way of doing it. It's not about the rate of death, but it's about who is dying and why the individual is dying. So this can, at a point in time, that improve our maternal, newborn, and child health.
Thank you, Dr. Man. Thank you. Very elaborative explanation. What are the roles of registries and what are actually the registries for those people who doesn't have any idea? Can you shed a light on it, please?
Well, you are the best person to answer the question because you are actually running that. But again, that is your frame. Unless you have a frame, anything that you have then as an enumerator becomes questionable. The registry provides you that frame of your population. Let it be registering pregnant women, and let it be registering birth, let it be registering children who are coming for immunization. That gives you the frame. Once you have the frame and you're confident that my frame is complete, okay, cannot be 100%, fine. 95%, then you know that in terms of birth, that I have 95%, if there are 100 births, 95 I have registered, I have confidence. So anything that happens to that denominator, then your numerator will make sense. What I was kind of disconnected, I think you guys were discussing about the routine health information, or 𝗪𝗪𝗕𝗏 or HMIS. The bigger challenge with specificity level data is that all numerators, we don't know our denominator. Our catchment population was probably estimated or calculated, I don't know, in 1990 or 1998. And then we are using these multipliers every year. How good are those multipliers? I don't know. Is population growth of 𝗪𝗏𝗙𝗪 as good as population growth in 𝗪𝗏𝗙𝗪? I don't know. Is population growth in district South or district 𝗪𝗓 in Karachi as good as 𝗪𝗏𝗕𝗏? I don't know. So these multipliers, use them as a standard. So we multiply it at the national level, and then we multiply it at, I don't know, 3.1 or 3.4 or whatever number at the provincial level. These, we all know that they vary. So the histories will then take care of this issue of questioning the data, because we have questioned the data for so long that we have not made use of whatever exists to us.
Very well said, right, sir. And we need, obviously, we all will agree that there is a need to connect the government database with the local registries or institutes or private institutes where we have routinely collected data, so that we can have, and the trainings of that private institutes as well by the government, so that all data should be collected at a standardized format and be shared centrally.
Exactly. One thing that I just want to mention, that the role of us, like the global or SZABIST or other institutions, we should not try to replace what government should and can do. Our role should be as groups that can identify the issues, can recommend improvements in the existing system, and then can evaluate whatever has been done by the government. It ultimately, yes, but they can work as a public-private partnership, which they are very keenly with them. MCH, RHCs, PHQs, they have all been either outsourced to public-private partnership. Yeah, that can be done, but that does not mean that we start behaving like the government. No, our role should be that. For example, if I am running an agency, the idea of running that agency should be that I'm going to use the information to my work and help the government make decisions. So that's another area. I mean, for example, sometimes we have registries, sometimes we have making surveys, sometimes we have pilot projects. They are important. But this is my personal opinion, and people, yourself can disagree, that we should not try to be the government. It's very easy to criticize the government.
Yes.
But you have to understand that the number of people that we have and the amount of work that we have in health, it can only be done with the government support.
Thank you, Dr. Imran. So nice of you for your, kind and presence and your expertise, which we are currently unable to, because we lost your connection, and because of the internet connectivity, which happens, it's an operational procedures, so it happens sometime. But we would definitely get in touch with you in terms of arranging a second webinar with similar topics of different domains, and we will see how that will be useful for our students as well, for the SZABIST, Masters of Public Health. and development of future implementation and plans to run different projects in terms of health policy.
Definitely, and I really I use internet all the time. I conduct meetings, but this was the first time I used this platform, and it did not work. I could hear you very well. I don't know why there was something wrong from my side. So my apologies to all the people, to the audience. But yes, I would love to do it again.
Definitely, it would be our pleasure, and are highly recommended that definitely Dr. Imran will be called upon and requested to discuss certain public health issues. Now, I would suggest Dr. Sameera to have her kind words so that we can go towards finalization of the webinar.
Thank you so much, Dr. Imran and Dr. Bilal, for your useful and very informative insights. So basically, what we conclude with today's discussion is that though we have several surveys, national and occurring at the information is also coming from other sources as well. Our students and we as researchers can make use of those databases, especially in the field of maternal and child health. Though there are some barriers, but there is always a solution to those problems. There are challenges. We have difficult times, but the research, our objectives, our mandate should not stop. We should keep working. I'm glad, Dr. Bilal, you drew our attention towards the importance of verbal autopsy. Verbal autopsy has a very, very major role in terms of maternal and childhood deaths. So our students and we as researchers, again, I would stress that we can work on those lines. Thank you, Dr. Imran, for talking to us about the importance of point estimates and interval values. So these were some very useful points that we have discussed today. But last but not the least, we had a very limited time of almost 45 minutes to 1 hour. So we have tried to make use of this time, and we will inshallah have another series of webinar, and we'll invite our guests again, and so that we can have a more deeper conversation and discussion in terms of maternal and child health problems and research that is really needed along in this area. So thank you so much. I'm again thankful to Dr. Bilal and Dr. Imran. Thank you so much.
Thank you,
Bye
Dr.
bye from my side.
Thank you very much.
Thank you, Dr.